All right, welcome back to another live Facebook Lunch and Learn at PROCare Physical Therapy. Dave Tranchita here. I am the CEO and physical therapist at both our clinics, one in New Berlin and one in Greenfield. Today we are going to talk about how to treat repetitive overuse injuries, especially nowadays that spring is finally here, and how to use what we call P.R.I.C.E. And P.R.I.C.E. is to protect, rest, ice, compression, and elevation. So anytime you have an injury, again, if you can remember the wording of P.R.I.C.E., you can kind of follow suit for the first 72 hours so that you don't have a flare-up injury and you can manage it by yourself. So some of the injuries that we see that are coming through this spring is, of course, people are back on the golf course, so we get golfer's elbow. Golfer's elbow basically is the lateral part or the outside, the inside of the elbow that people are over gripping. They're going out and playing probably more than 36 holes in a weekend. And so when we look at the chart here, we can have different areas in the elbow that can have these muscles get overused and refer pain patterns down into the hand. You could have numbness and tingling. You can have tender points, and especially pinpoint right at the lateral or the medial epicondyle of the elbow. So the other one is tennis elbow. So that is on the outside, that's the lateral epicondyle. Again, the same thing with repetitive overuse. Again, people can have lateral elbow pain, referred pain down the elbow, but mostly very pinpoint right on the bony attachment of the lateral epicondyle. Something to look at when you're talking about gripping activities or using a club, baseball bat, tennis racket is take a look at the size of the grip. The grip is either too small or it's too large for your hand. And so talk to your professional, your coaches, to see if you need to add some grip, get new grips, or reduce the size of the racket or club that you've got. Some other things that we're seeing is rotator cuff, repetitive overuse, tendonitis, bursitis, from those baseball players, pitchers, throwers. Again, you see from repetitive overuse that these injuries are irritating, they swell. So again, remembering to protect it, rest it, ice it, compression, and elevation. Now, when we talk about resting it, it's basically just that. You're basically not going to be doing your activity. You're going to give it 72 hours of pure rest. And then how do you protect it? Again, protecting it, again, you can put it in a sling. You can use a brace. We do have various different things that we use for tennis elbow. Okay, you can go right around the elbow here. You can use this for also patellar tendonitis. So in the kneecap, people who are runners, jumpers with track and field, getting out and running some of those 5Ks, those fun runs, we develop tendonitis of the kneecap, which sits on the patella or the kneecap. Your quadricep muscle is up here, so what happens is you get an impinging sensation into the knee, which is causing inflammation. So with this strap, again, this can go right around to add support of that knee. The other thing that we're seeing in runners is plantar fasciitis. Now, what is that? So the plantar meaning the bottom of your foot. Fasciitis is the webbing, fibrous tissue that's in the foot that these muscles of the calf attach to. So when we look at the calf here, again, you're going to get tightness up here, which is going to cause inflammation and some tightness down here or compensation. You can also have various different trigger points in the muscle that can have referred pain patterns as well to the heel and develop Achilles tendonitis. Again, there are supports. I like using a heel lift temporarily to put under the heel to take the stress off and unload that joint, again, for 3 to 5 days, and then get back into activity. So a lot of the things that you can do are self-management, things at home. You don't have to go see a physician right away. If you do know a healthcare provider, a nurse, physical therapist, chiropractor, they can give you some advice over the phone. But a lot of it is, again, just protect the area for about 72 hours, rest the area for about 72 hours, use ice to get the inflammation and swelling down, compression using a compression sleeve, a brace, or some of these devices that we showed you, and of course elevation. And elevation is going to basically, if there is swelling in the arm, in the leg, again, you want it above your heart while you're icing so that you can actually get the fluids moving to the lymph nodes, which again are around the armpit or in the groin. So when you elevate, that fluid gets exchanged back through the kidneys and out of the body, so it's not pooling. So that is our Lunch and Learn Live video. If you have questions, please answer them below. Thank you for joining us, and we'll see you next week.